the media on a special meeting of the KZN Church Leaders Group on plans to curb the spread of the novel coronavirus within their congregations. And this follows President Cyril Ramaphosa's pronouncements. As you can see, it started. Let's go there now live.
As the word of God says, that people perish because of lack of knowledge. The only way that we are going to be able to contain the spread of the disease is by ensuring that each and everyone next to us has all the information about how the disease is spread, what happens to the body when it has been infected by the virus, how it is transmitted, and how that person is managed, and also how the other close contacts of that person, be it family members, be it the community, be it fellow workers, can be protected from getting the disease. I have a few copies. I was not sure of the number of the attendees to this meeting. I made a few copies. If they are not enough, can we please share? And I just want to say we can all use this presentation when we speak to our congregants or to anyone. It is available. It is in the public space on behalf of the Department of Health and can be used by anyone, whether to discuss on a one-on-one basis or to address a group of people. Now, in the first slide, it says, what is coronavirus? So the presentation, as I've said, will cover what is coronavirus, who is at risk, what will authorities do, and what does quarantine and isolation mean, and how can we stop the infection from spreading in our community, and what is the role what is my role if I'm not infected? Now, there is just a historical, to any disease on earth, there is a historical basis on how that particular disease originates in terms of whether, in terms of that bacteriological species or the virus species, which means you need to know what type. Scientists, that's what they do. They first study, in order to be able to come up with treatment, they first study how the virus came about and what the bacteria, how did it end up reaching human beings. So the first slide speak about that this virus originally caused infections among animals. It does cause infections amongst animals and humans, but it originated from animals like birds and like camels. However, it has crossed to human beings. It is not yet clear scientifically how it did cross from animals to human beings, but that's what we get from the scientists, that it has crossed and is now causing what we call a common cold amongst human beings. We might not bother ourselves about the detail in terms of the species and so on, as long as we know that it causes a common cold amongst human beings, and it is there are various types of this virus, and this one is known as SARS-CoV-2, which causes a coronavirus disease, or what we now commonly know COVID-19. So when somebody in short just says COVID-19, means coronavirus. So now, what are the common signs and symptoms of coronavirus? If you look on the slide there in red, it says common. Firstly, let's start with the ones on the right-hand side. There is fever. After 2 to 7 days, the person will develop a cough. Then if the disease progresses, then the person will have breathing difficulties. Something like a tight chest, cannot be able to breathe, and so on. And may have problems in the stomach, like diarrhea. and general body aches or body malaise. However, as we said, that this is a common cold. If that person's immune system is not good or there are other reasons and the condition becomes severe, how will you know that the condition has become severe? That person will have a high fever of about 38 degrees. That person might end up having pneumonia and kidney failure, and that will cause death. Now, how does the condition get transmitted from one person to another? And I think this is a critical part that we need to understand. The disease is transmitted from one person to another through what we call droplet infection, not by just breathing. And droplets come out of our bodies, either through the mouth or through what? The nose. And these droplet infections, then they either land on different surfaces. So this is how it is transmitted. I don't want to expand because I'll get there. It's from droplet infections from your mouth or from your nose. I'll end there for now. So next page. How long does the person take to develop the symptoms? 1, the symptoms take 3 to 8 days to develop. That is one thing also that we must take cognizance of, so that we are aware that it's not everyone. You cannot see clearly that, oh, this one has got coronavirus, because the person might still be doing what we call incubating the virus. It's still within your body. It has not started showing its symptoms. It is likely to show symptoms from 3 to 8 days after being infected with the condition. As I've said, in 90% of people, it will show, there will be fever, there will be dry cough and tiredness. Again, let me repeat that. There are people that will have experienced severe symptoms of the condition depending on their state of health. We know that elderly people, as they grow older, their immune system goes down. They easily get colds, they easily get diseases like diabetes, like sugar, and so on and so on. So their immune system is low. So when they get the condition, their condition might not be easily overcome as younger people. So they are the ones that might have complications of the disease. It is also said that very few children are affected by the disease currently. There are very few children who are affected by the disease. But in terms of then the outcome of the disease, what happens by and large? Do we all, if you get coronavirus, are we all going to die? Once you get infected, you now know that you are on your way to greet the master. No. In 80% of cases, people survive. That should be our strong message. Which means the death toll is not as high as the infection rate. You might have 40,000 people that are infected, but only 2% of those will die from the disease. However, the spread and the transmission is very high, but the mortality rate is low. The 15 to 20% out of those that are infected, 15 to 20% may develop pneumonia, as I have said, because of their immunocompression or their low immune system. they might end up with pneumonia and require admission. Then a small percentage that will go to kidney failure, what we call respiratory failure, difficulties with breathing. A percentage of 5% will require admission in an intensive care unit because their systems have failed. Their kidney system has failed, their respiratory system has failed. They might require to be admitted in an intensive care unit. And then only 2%, as I've said, will die from the disease. So how do we diagnose? How do we diagnose? We don't take bloods. We don't ask people to cough. We don't take urine specimen scientifically as for now. All that is done, we take a swab. And we said the disease is transmitted from droplets from the mouth or from the nose. So what we do, we take a swab from the throat and we take a swab from the nose because that is where the virus lives. And that swab is then put in a gel-like substance and taken to the laboratory for testing. Okay, let me talk about this thing of testing because there is a lot of media misinformation and there are people that are taking an opportunity of everything that we are doing. There are WhatsApp posts that are circulating that are saying, which could be true, number one, that there are those people now who are going around knocking at people's houses and saying that they have come to test them for corona. And in the course of that, they rob them, they take their assets and so on at the household. And then this WhatsApp message says there is no door-to-door testing, which is not true. There is door-to-door testing at the moment. We are sending our teams from Department of Health to go and, one, follow up on the contacts, two, to then also do the testing and the taking of the swabs. Why do we do that? To test people at home. Reason being, once you indicate that either you have traveled to these disease endemic countries, those that have been affected by the disease, China, Italy, US and UK, and you say you have traveled to those countries within the last 14 or 21 days or so, and or you have been in close contact within 100 meters of a person who has been confirmed positive as having the disease, we say to you at the moment, stay at home, right? Then we then look for who, if we find that the person who possibly infected you is positive, we then come to your house to go and do the test in your own house. Reason being, should it happen that you are already infected as well, we don't want you going into a taxi or into a bus or into a train, going and where there are 100 people or 50 people or 20 people in a taxi. We don't want you to go in there and maybe you have already got symptoms, coughing and sneezing in a taxi or in a bus, and then infecting everyone in a bus whilst you are on your way to a clinic or a hospital to be tested. So that is the reason why we are doing door-to-door testing. Maybe that will change as the number of people who need to be tested increases. Maybe we will have areas where we test people. That is not the case yet. At the moment, we test at home. However, if there are people who come in with symptoms and are not well, we admit them and those are tested at the hospital. So I just want to clarify that there is door-to-door testing. However, we know that the rate of crime is very high. I also want the leaders to know, to inform their congregants that we will never come to any house for testing by surprise or unannounced. First, once a person is identified as a contact who might be positive, you get phoned. Currently, you are being phoned by the National Institute of Communicable Diseases. They will phone you and tell you that and take your details, ask you how you are, whether you've got these symptoms, and then they'll tell you somebody on such a day will come to your household to do the test. So there will be no one who will come to anyone's house unannounced and not being expected to come and do the testing. So yes, homeowners must just not accept anyone who just rocks up on their doorstep and say, I've come to test you. They must say, no, no one has phoned me. So I've spoken about testing. I won't go into the details of what the RNA and so on. The next slide on page 4 talks about the droplets. As I'm saying, that it shows that, but if I breathe in the droplets standing 1 meter of a person who is infected, I'm likely to get the infection. So I just want to talk about this thing of droplets. As I say, it's droplets either from my mouth or from my nose. So what do the droplets do? The droplets then land onto the mic that I'm speaking on. They land on the paper that is in front of me. They land on this pulpit. And then I go away. Then the pastor or the priest comes over, puts his hands on the pulpit. Or the person who's organizing the mass puts her hands over the microphone. And then the infection is transmitted from the microphone, from the paper, from the pulpit onto my hands. Once they're on my hands, then I feel like sneezing or something irritating me, touch my nose, touch whatever, and I do this, then the infection gets into me. Right? So the infection does not, by and large, come from sneezing only from one person to another. It gets onto surfaces. And as you touch you put your hand on the surfaces, you touch your face, you then transmit it to yourself. However, the latest article I read yesterday was saying sometimes the scientists are now saying from the World Health Organization, droplets also get suspended in the air. They might get suspended in the air, and you might get them. But that is new evidence that is still going to come along. But now, only we are sticking to say, that is why we are saying, make sure that your hands are always sanitized and clean, because it's very difficult to avoid touching all over the place. We are likely to touch all over the place. We are likely to touch your face. But we'll come to that when we come to infection, to the prevention. So it's droplets. When you are standing within 1 meter of a person, may be transmitted to you, or it's by direct contact after touching the mouth, or touching your nose and eyes, or touching surfaces that have got droplets of the condition. So, how can we stop the condition, the disease from spreading? One, I'm sure everyone is aware that everyone is talking about masks, gloves, and all types of masks, and so on and so on. One, there are different types of masks in the first place that we must understand. There is what we call surgical masks and N95 masks. Surgical masks that we wear when we are operating in theater or doing things, those are kind of masks. They are able to contain the invisible droplets which may have the infectious, which may have the droplets. Then the N95 masks are the most masks that are able to filter 90% of the particles, which means 90% of the particles will not get through when you are wearing a 95 mask. But who should use these masks? That's what we understand. I want to read this out so that it's clear to anyone. The World Health Organization says that members of the public who are well don't benefit from wearing masks. So you are well, you are wearing a mask. I've seen even people in the street wearing masks. It does not give you any benefit because you are well. The mask, sick or coughing person protect other people by wearing surgical masks. So a person who should wear a surgical mask is a sick person. If you are coughing, sneezing, and you are not sure, and maybe you already know you have been to Italy, and you start coughing and sneezing, in order not to spread the infection to other people, wear a mask. So when you are wearing a mask, you are telling us that you are either coughing and sneezing, and you have been either in close contact with a positive person, or you have traveled to the endemic countries. Because a mask is for protecting other people, not protecting yourself.
All right, those were live visuals with regards to the KZN Council, Christian Council, briefing people about their plans in order to curb the COVID-19. I want to bring you these